Hi, I'm Erin, your local sex therapist, and today I'm here talking about desire. Now, desire is something that can be hard to define, right? If someone asked you to define what that means to you, it might take a minute to figure out what to say and how to verbalize that. Maybe it's because it's a feeling and everyone experiences it differently. And I'm going to normalize here that everyone has different desire, right? And that desire responds to different stimulation. And even though we all have different desire, we tend to think about and talk about it in one general way, that it just comes on its own. But there are two types of desire, right? And knowing what you have can help you engage in sex in a way that fuels your desire, because as we now know, everyone's is different and responds to different things. So today I'm going to talk more about the one that typically comes to mind, which is spontaneous desire, and we'll lay some groundwork here. Next time, I'm going to cover the lesser known, but just as important, responsive desire. So, if in today's conversation you feel you can't really relate to this type of desire, don't worry, come back. I suspect responsive desire may be a better fit for you if so. Okay. So, the most well known desire and what typically comes to mind for most people is spontaneous desire. This occurs when someone simply feels an interest in sex. The urge seems to come on its own and leads one to seek out sex. Desire happens, right? The feeling happens, and it leads to physical arousal and gets the blood flowing. Now, anyone can have this type of desire, but it tends to be more common in those with male genitals. And without getting too sciencey today, the reason we think that is due to how we all learn about sexually relevant cues, which simply put are cues that arouse you. Right? So when boys and those with male genitals are growing up and get erections, those erections are pretty obvious to them. So, what happens is those individuals learn to pay attention to their bodily cues to inform what's sexually relevant. I suddenly feel this way and notice this change in my body, so I should seek out XYZ. To assess if you have this type of desire, think about how you go about engaging in sex. Do you suddenly feel an urge? Is there a feeling that comes on that leads you to want to seek out your partner? If so, you probably fall into this category. And if not, don't worry, right? Just because your desire doesn't come on its own doesn't mean there's anything wrong. It just means maybe you don't have spontaneous desire, and that's okay. Next time, I'll dive deeper in responsive desire and how this shows up. So we'll see you then.